My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide and tirzepatide are two advanced medications used in the management of type 2 diabetes? Both drugs are part of a newer class of treatments that significantly improve blood glucose control while lowering the risk of hypoglycemia, a common and serious side effect associated with many diabetes treatments. Hypoglycemia, or low blood glucose levels, can lead to symptoms ranging from mild discomfort to severe complications such as loss of consciousness or seizures. Semaglutide is a GLP-1 receptor agonist, an incretin hormone that plays a critical role in glucose homeostasis. It enhances insulin secretion in response to meals, which helps lower postprandial glucose levels. Importantly, GLP-1 also suppresses the secretion of glucagon, a hormone that raises blood glucose levels by promoting the release of glucose from the liver. The dual action of increasing insulin and decreasing glucagon leads to better glucose control. However, a key feature of GLP-1 receptor agonists like semaglutide is that they work in a glucose-dependent manner. This means that their effects on insulin and glucagon are primarily active when blood glucose levels are elevated, such as after a meal. When glucose levels are normal or low, the activity of these hormones is minimal, reducing the likelihood of hypoglycemia. Semaglutide also slows gastric emptying, which delays the absorption of glucose into the bloodstream. This results in a more gradual rise in postprandial glucose levels, further stabilizing blood sugar levels and reducing the likelihood of glucose dips that could lead to hypoglycemia. Appetite regulation and weight loss. Weight loss is a common effect of semaglutide due to its action on appetite centers in the brain, leading to reduced calorie intake. This weight loss contributes to improved insulin sensitivity, further aiding in glucose control. While weight loss alone doesn't directly prevent hypoglycemia, the overall improvement in glucose regulation reduces the need for higher doses of insulin or other medications that can cause hypoglycemia. Tirzepatide, mechanism of action and hypoglycemia risk reduction, dual GIP and GLP-1 receptor agonist. Tirzepatide is unique because it is a dual agonist of both GLP-1 and glucose-dependent insulinotropic polypeptide, GIP, receptors. GIP, like GLP-1, is an incretin hormone that stimulates insulin secretion in a glucose-dependent manner. The dual action on GLP-1 and GIP receptors provides a more robust control of blood glucose levels, reducing postprandial spikes. Similar to semaglutide, tirzepatide's effects are glucose-dependent, meaning the drug is less likely to cause insulin secretion when glucose levels are low. This glucose-dependent mechanism is crucial in lowering the risk of hypoglycemia. Enhanced insulin sensitivity. Tirzepatide also improves insulin sensitivity, particularly in the liver and muscle tissues. Enhanced insulin sensitivity means that the body's cells respond better to insulin, allowing for more efficient glucose uptake from the bloodstream. This improved response reduces the need for exogenous insulin or other glucose-lowering medications that can increase the risk of hypoglycemia. Suppression of glucagon secretion. Like GLP-1 agonists, tirzepatide also suppresses glucagon secretion, which reduces hepatic glucose production. This effect is particularly beneficial during fasting states when the risk of hypoglycemia is higher. By suppressing glucagon, tirzepatide helps maintain a stable glucose level without causing hypoglycemia. Weight loss and satiety. Tirzepatide induces significant weight loss, which is associated with improved glucose control and reduced insulin resistance. This weight loss is achieved by acting on the brain's appetite regulation centers, leading to reduced food intake. As with semaglutide, the improved insulin sensitivity and reduced need for additional glucose-lowering medications help lower the risk of hypoglycemia. Comparative hypoglycemia risk in clinical trials. Clinical trials have consistently shown that both semaglutide and tirzepatide are associated with a lower risk of hypoglycemia compared to traditional diabetes treatments like sulfonylureas and insulin. In these trials, hypoglycemia was mostly reported in patients who were also taking other glucose-lowering medications, particularly insulin or sulfonylureas, which are known to increase the risk of low blood glucose. For instance, in trials where semaglutide was compared to other diabetes medications, patients on semaglutide had fewer episodes of hypoglycemia. Similarly, Tirzepatide has demonstrated a low incidence of hypoglycemia, even at higher doses, compared to other diabetes treatments.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.